Waianae Coast Comprehensive Health Center, a business review by Krista Kumahata. The Waianae Coast Comprehensive Health Center, or WCCHC, main campus is located on the west coast of Oahu, Hawaii. Waianae is a rural, unincorporated area with a population around 13,000. 48% of the population are Native Hawaiian, with 21% of the population living at or below the poverty line. This nonprofit community health center is the largest federally qualified health center, or FQHC, in Hawaii, offering primary care, mental health care, and dental care at one location. The mission statement of the health center focuses on the goals of addressing health disparities, improving community health, and eliminating financial and cultural barriers to good health. The center has 7 service sites and 3 additional sites within area schools. This shows tremendous growth since the center's beginning in 1972. Currently, there are 664 employees, most of which live along the Waianae coastal area. The health center houses modern medical services, but also incorporates traditional Hawaiian healing practices and is known as a healing center. These practices include Hawaiian massage, herbal medicine, spiritual healing, and conflict resolution. The center is also a learning center. WCCHC has a priority of investing in the community with programs that effectively have created a career pipeline, including a nurse practitioner residency program and a partnership with A.T. Still University School of Osteopathic Medicine for medical residents. As a potential employee of WCCHC, a contract of employment would be considered. Contract negotiations are an important part of the hiring process. There are several essential items to consider. First of all, duration. The average contract should be for 1 year, with the first 6 months a probationary period. Compensation. As a new nurse practitioner working in a rural area, the starting salary may be below the state average. Part of the appeal of this health center is the missional aspect of the work, and that could offset a lower starting salary. A straight salary arrangement with a clear job description could be offered. As part of the job description, there should be administrative time built into the week in order to maintain timely notes. Insurance. This would include health insurance and malpractice insurance. WCCHC offers an 100% employer paid health insurance option, which is attractive. Part of the contract negotiation would be employer provided malpractice insurance. Bupert recommends at least 1 million per claim and a policy that covers the cost of a lawyer for the nurse practitioner. Fees. The ideal contract would include a section stating the employer would pay fees associated with obtaining any additional needed licensing and renewal fees in the future years. Fees for professional organizations could also be included. Evaluation. Clear language on assessments and evaluation of the nurse practitioner should be included in the employment contract, and actions that will be taken if the evaluation finds the NP lacking. WCCHC has a variety of funding sources. The majority of revenue comes from patient fees, including Medicaid, Medicare, private insurance, and self pay sources. The rest is made up of grants and charitable giving. The center has also formed partnerships with other local health center communities to work toward health system reform and has joined a national group of health centers to share best practices aimed at providing affordable, quality care to everyone. Reimbursement for FQHCs can be complicated. To qualify as an FQHC, the facility must provide care to all residents in their service area, with fees adjusted based on patients' ability to pay. Therefore, they must have a sliding scale in place. For patients with Medicaid or Medicare, the facility is reimbursed an enhanced rate above the general Medicare and Medicaid rate. This enhanced rate can be further increased based on the geographic location of the facility, but both Medicaid and Medicare reimburse a nurse practitioner at 85% of the physician rate. In the past, FQHCs have been paid through a prospective payment system that provides a bundled rate for all primary care visits, regardless of the type or intensity of the services provided. But some healthcare centers are trialing alternative payment methods where payment is based on quality and costs of care, not volume. This may be the future. To look at reimbursement rates, here is the enhanced FQHC rate for a physician in 2022, $176. A nurse practitioner working in an FQHC can collect 85%, which in this example would be $159. An NP in this type of comprehensive health center setting would see several sick patients, have several well visits, and participate in one of the holistic health programs, such as the smoking cessation program or the diabetes management group program. As indicated in the ideal contract, each week would have administration time built in. In an 8-hour day, as a new family nurse practitioner, 16 patients seems reasonable, but in time, the FNP would need to see 3 to 4 patients an hour. There is a possible collection of $2,544 on this sample day. Patients have lots of options at WCCHC, however, including a sliding scale and cash discounts, so daily billable amounts may vary widely. According to the U.S. Bureau of Labor Statistics, the annual salary for a nurse practitioner in Hawaii for 2021 was $115,000. While Hawaii is not listed among the top paying states for nurse practitioners, Waianae Coast Comprehensive Health Center offers some other benefits. Some of the most attractive are an annual bonus for years of service, National Health Service Corps loan repayment options, generous PTO with paid holidays, an employee fitness center with an ocean view, relocation assistance for out of state employees, and a pension plan. Let's look at the most recent published budget for the Waianae Health Center from 2017. The total amount was $73 million. Dollars. Here are some of the budget highlights. $45 million for staffing, including salaries, compensation for board members, benefits, retirement, and travel expenses. $8 million for taxes, including payroll taxes and occupancy taxes. The office figure includes supplies for all the campuses at $8 million. $200,000 for technology services, including electronic health record maintenance. $50,000 for advertising. And although the health center has various funding streams, the center also has taken out loans, and the interest is $3 million annually. Hawaii is a full practice state, meaning that there is no required supervision or collaboration with the physician for a nurse practitioner. In Hawaii, licensed APRNs can practice to the full extent of their training, including evaluating, treating, and diagnosing patients. NPs can also prescribe medication and controlled substances by the authority of the Hawaii Board of Nursing. While Hawaii does not require a formal collaborative agreement between a physician and the nurse practitioner, because the health center is truly a comprehensive facility, there will be informal collaboration concerning patient care and referrals to other services. This collaboration will aid the nurse practitioner in staying in compliance with billing in a federally qualified health center, which requires physician collaboration for reimbursement, no matter the state practice authority. There are several ways employers evaluate NPs and should include a combination of quantitative and qualitative reviews every 6 months to a year. Four areas of potential focus would be productivity, safety, peer reviews, and service. Productivity could compare the numbers of patients the NP sees with other NPs in the clinic and nationally. If the average full time NP sees 3 patients per hour, is this NP meeting that goal? WCCHC has a new NP residency program. This indicates the center's recognition that new NPs need guidance and time to adjust to the new role and expectation of productivity. This evaluation would be performed by the residency program director every 6 months to a year. Another evaluation method is safety. This is tied to positive patient outcomes. WCCHC has several programs focused on community health, such as smoking cessation and a holistic diabetes management program. As the NP creates new such programs and leads established groups, are the patient's measurable health goals improving? This would be performed through chart audits. Peer reviews. Ideally, the nurse practitioner would have feedback from clinic staff, including physicians, nurses, and other NPs, about once a year. The 360-degree feedback model is one method of achieving this. Some questions could include: what growth area would my peers like me to focus on? What behaviors or skills exceed expectations? The center's mission focuses on the underserved community on the west coast of Oahu. Not only does the clinic seek to address medical care, there is also an aspect of job training and development for the local community. As an employee, how is this NP joining the mission of the organization? How is the NP participating in community life? Again, the nurse practitioner residency director would perform this evaluation. To practice as an APRN in Hawaii, one would need current licensure based on accredited education and certification in a state recognized APRN role, such as family nurse practitioner. Hawaii is not a compact state, so Hawaii specific licensure would be needed to be obtained. APRNs have prescriptive authority in Hawaii and would need to apply for a DEA number. Hawaii's Board of Nursing is part of the Department of Commerce and Consumer Affairs. The state has agreed that NPs can serve as primary care providers. The Board of Nursing has also outlined specific privileges APRNs enjoy in Hawaii. A few of the highlights include the authority to evaluate the health status of patients using all the skills acquired in their advanced training. The ordering and interpreting of diagnostic tests is also allowed. And most importantly, the APRN is given authority to formulate a diagnosis and then plan, implement, and evaluate care based on the diagnosis. WCCHC will have written policies and guidelines that will guide the nurse practitioner's actions when a patient needs a higher level of care, such as a referral to an outside specialist or hospital admission. When a situation occurs and there is no clear guideline, knowledge of evidence based practice should be used. Often, facilities have chosen an outside resource for this, such as Mosby Skills, so that healthcare providers can ensure they are providing safe care. Ultimately, the FNP should not perform anything specifically prohibited by the Hawaii Board of Nursing. Thank you for listening to this presentation, and aloha.